The Lagos State government says integrated mental health care services in primary health care centers is imperative. The Permanent Secretary, Lagos State Ministry of Health, Dr. Olusegun Ogboye, who made this comment during the health workers training at Alausa, says incorporating mental health care services into PHCs aims to address the issues at the grassroots level.
Sometimes, even without knowing,
primary healthcare workers in Lagos State converge on the Lagos Chamber of Commerce and Industry, Alausa, Ikeja, for a mental health capacity training session.
Because in different places, people are still doing the same things, tying them down, chaining them, because they believe that that's the best way they can get better.
This exercise, organized by the State Ministry of Health, is to help the health officials recognize and manage common mental disorders in patients.
Psychosis occurs frequently. And so if we have between 100 to 200 people, you will find one person that will have a psychotic episode. It may seem like a statistic, just like a number, but it happens. And you see, what happens is that beyond the person who is sick, everybody else suffers. Do we agree? Yes. I was driving towards Third Mainland and I was trying to buy something in traffic, which I rarely ever do. And as I was giving the guy money, I just saw a mentally ill person sitting in front. And I thought about the fact that, what if this guy hasn't given me my change by the time I get there and this patient person? That's pressure for me. And this means the environment. But imagine that that person has a home, has a family, has a job. Many years ago, I managed a patient who left his job in Mina. He ran away from Mina because he believed that the people at the office wanted to kill him. So work suffers. Relationships suffer. Families suffer. We've had patients who have done some traumatic things to their families. Many years ago, we had this patient in Yaba who put children inside a container and set them ablaze. Psychotic.
According to the World Health Organization statistics released in January 2022, over 20 million Nigerians are currently suffering from various degrees of mental illness or disorder. For the project coordinator, the training is in line with the World Health Organization Mental Health Gap Action Program Intervention Guide.
We also have organizational integration, and part of what we're looking at is that hub and spoke model, where the primary care centers around general hospitals that have mental health services receive mentoring and guidance and supervision from them, and they're able to refer to those specialists, get backwards referral as well once they complete the specialist care that they require, so they can get their day-to-day care at the primary care center that is closest to them. And on supporting them, of course, with the mental health helpline, both for themselves, because providers also need support. And sustainability and expansion, and we're looking at a future where all our primary care centers, flagships or not, are able to provide mental health services. All our general hospitals are able to provide some mental health services, and of course strengthening the functions that will be happening with our partners in LUTH, LASUTH, the Federal Neuropsychiatric Hospital, and in the near future, our major landmark facility that will be established in K2. The key activities for the project are essentially along these domains. The first part, of course, is developing that change mindset and change management that we want to implement. And the training, of course, is based on WHO's Mental Health Gap Action Plan Intervention Guide. That's what the GAP IG stands for. And we are focusing on 4 key domains at the moment. And as we progress and we upskill our staff, we're going to be expecting the opportunity for them to also be able to do more as they were. And I think it's important to also mention at this point that the enthusiasm that we have seen so far, especially amongst the community health extension workers, health officers, as well as the health educators, has been amazing and truly, truly inspiring.
The Permanent Secretary, Ministry of Health, Dr. Olusegun Ogboye, says the integration of mental health services in primary health care centers is critical towards addressing the comprehensive health needs of the people.
Even at secondary level, our mental health program is not as robust as it should be. We don't have enough psychiatrists, for one. We're even just trying now at state level to bring in the cadre of clinical psychologists who can do a bit more than regular psychologists and less than doctors. But if we had them, it would greatly strengthen our system. So that's something we're working on for trying to address the shortages we have with our psychiatrists. The other thing I wanted to say is referrals. The most important thing for any health professional, any professional in any field, is to know your limitations. Know that this is where I can get you up to. Beyond that, I'll pass you on to the next person. So this program does not empower us to start to treat the whole spectrum of mental illness. One, it does not empower us to treat even the spectrums the parts of the spectrum that we've been empowered to treat from beginning to end. There's a role that we have to play, and there's a point when we then pass the person off to the next level. What is important is that linkage, that exchange is done in a way that does not add to the trauma of this patient. That is something we really need to work on to make sure.
Some of the medical participants commend the state government for the knowledge they have gained.
I really appreciate Lagos State Ministry of Health for this training. So my take home is early observation of the symptoms of mental health, okay, and then early presentation to the health system, the facilities, and then, because they are bringing it to the grassroots, there's no need for stigmatization, okay? That's one of the take home, because you and I, another take home story is that anybody can be a victim of mental health.
I've learned that a lot of things we even see as normal mental illnesses. I've learned that we should not stigmatize people with mental illnesses, because even the stigma kills faster than the illness itself, or it can even destroy them faster than the illness itself. And I've also learned that we need to educate the community, because a lot of people are not quite oriented or aware about these things, and health education is really key. So when we orientate the community, when we orientate the people, it will be a safer space for all.
Over 300 health workers have been taught how to act as the first port of call in the management of several mental health conditions and when to refer to a higher health institution.